Every month, the Needham Police Department convenes with the Needham Public Health, the Youth and Family Services, and the Council on Aging to discuss ways to help individuals who were once in crisis related to substance use disorders, mental health conditions, domestic violence, and elderly needs. They call themselves the Community Crisis Intervention Team, or CCIT. In recent years, the team has grown to include more social workers, a community outreach officer, and an embedded clinician in the police department. In partnership with one another, they not only respond to urgent situations, but also follow up with individuals to direct them to local and state resources. By intervening at the early stage, their goal is to break the cycle of recurring incidents and enhance resident health and community safety. I talked to the team's core members, and in this program, we take a closer look at how the partnership works. We'll also explain how Needham police officers are trained to better respond to mental health emergencies. Carol Reed of the Needham Public Health Department and Deputy Chief Chris Baker of the Needham Police Department are among the earliest members of the Community Crisis Intervention Team. Often dealing with recurring crises, they realized the necessity of building collaborations with all kinds of local service providers to proactively address the issues.
We often understood and got awareness of residents in need, yet there wasn't a way to come together and speak confidentially as service providers to address the issues we saw and then offer support and resources.
It was frustrating for our officers because oftentimes we'd be bringing people that were in crisis to the hospital, and then by the time that the hospital, either one, had a chance to evaluate the person, they were no longer in crisis, so they would let them go. We realized that we had to develop a structure where we could attempt to offer services prior to the person getting to this escalated phase.
Once a month, the Needham Community Crisis Intervention Team, composed of police and fire department members, social workers, and mental health and addiction professions, meet to devise a plan of intervention for chronic resident cases.
Each public health, social work, prevention, youth and family, the police convene the meeting, and based on 911 calls, they have people that they know are struggling and in need, but we each can bring a name and a need, and then we would talk amongst each other in a confidential way about people that have come to us for help or been called through 911 that we know we could intervene with, provide resources, and help them to break the cycle of addiction or domestic violence, which has addiction often intersecting, and whether it be social isolation or a mental health condition that's debilitating.
Studies have really shown that the earlier the intervention occurs, the more successful the interventions are. So if we can really, if a crisis starts developing or a mental health challenge starts to develop slowly, the quicker you can intervene in that, the better chances off that person are kind of overcoming those challenges. So really the purpose of the team is to highlight, okay, this person has, the police have been called to this person's house 3 times. We've seen some patterns of, say, substance use. This is just one example. And so let's get in there and intervene early before the person ends up getting, 10 times later, and then they're in the hospital because of overdose or something like that. And really the purpose is to try to get in there as quickly as possible. So all of us really keep track of those themes. How often is this person struggling? How often are they being called? What other supports can be put into place to try to intervene proactively and really stop those big crises from coming up?
No one really wants to go to the hospital, right? No one really wants to call 911. Sometimes when someone calls 911, that might be the most difficult day in their lives. So if there are ways that we can work with someone so that they, don't have to call out for help in a crisis, but we can avoid that crisis, that's our goal. So for example, with an older adult, maybe someone who's frequently falling, we want to see if we can avoid that next fall by maybe putting some help in the home. You know, maybe it's a simple thing like putting in a grab bar in the shower. Say it's an older person living at home that's struggling to keep up with their home, struggling to maybe prepare meals for themselves. It might be a referral to our traveling meals program to give them some more support, you know, if their goal is to stay in their home.
Other than the monthly meetings, every 3 months, the core members meet with community partners such as Beth Israel Deaconess Hospital, Newton Wellesley Hospital, and Riverside Community Care to obtain a more comprehensive understanding of the health and wellness situation in the community and the resources available to Needham.
So the hospital's walker comes, the Quincy Resource Center comes, they actually cover our region to offer some support. So a lot of different community providers come, and we talk about local trends, how are the hospitals doing, has there been an increase in mental health needs, are the emergency departments full of people who are in crisis? So just so that we can get a grasp on what's happening in the community at large. And then also what other resources are out there.
We don't discuss specific resident cases at that meeting because of the confidentiality. We talk about what protocols we have in place if we are referring someone to the hospital or the police are transporting them. We share data with what we see here in Needham with youth and adults, and they share data with us so that we can create programs to better serve people before they get to that emergency level, as well as build our bench of support. For example, one of the pieces of data they give to us is elder falls. And it's fascinating because in public health and social work, we can do education on fall prevention. So that's one example. Or overdose. And so we are doing programs on educating people about where they can get Narcan and have that through pharmacies on their person if they have a loved one perhaps who's taken pain meds for a chronic condition or a break, or in fact navigating an addiction issue, to be able to see that data, how many people from Needham are visiting the hospital in Wellesley or Needham for an overdose. We can do community programming to try to educate people.
The network built among all the local and regional agencies facilitates resident access to services and resources.
Through the Department of Mental Health in Massachusetts, they fund and support the emergency services program across the Commonwealth, and those service providers are cut up by region. Our region, with our towns, is serviced by Riverside Community Care. In the Framingham Metro West region, it's Advocates, funded through the Department of Mental Health. So Riverside has social workers that will take a call 24 hours a day, 7 days a week, and be able to guide families and adults if they're in crisis or want information after, say, 5 o'clock when we're closed. Additionally, they fund mobile crisis and intervention services to be able to evaluate people and keep them out of the emergency room if possible, which is traumatic, stressful in a crisis of mental health, and quite expensive. So that is available to anyone in the Commonwealth, again, by regions. So over the years, we do partner with Riverside and the emergency services team. In fact, in my work, if someone comes in for help, I will often show them by phone. I will call Riverside, the helpline, so they understand that they too can call, and introduce myself. I work in the health department. I'm here with Suzanne. She's concerned about her mother, and she's someone who's struggling with substance and addiction. What kind of support can you offer her? Could she bring her mom in for an evaluation in your office in Norwood, or are you able to come and do in-home evaluations? So we take advantage and collaborate with the state-funded emergency services programs.
Youth and Family Services offers free clinical services to the residents and students of Needham so they can get therapy. One of our goals is to eliminate all barriers to treatment. So some outpatient providers have copays or insurance company restrictions. We don't have any of that. The town really values mental health and really thinks that it's an important initiative to have, so all of our services are free. So we can offer free therapy for that youth and their family. We've also connected them to other resources. Sometimes they need medication management, so psychiatric medications. We work really closely with some local psychiatrists and nurse practitioner that can prescribe those medications, so we can get them connected to those services. We've also been really connected to some of the CBHI services, which are home-based services. So if a family needs in-home supports, family partners, therapeutic mentors, we can connect them to those services. And all of those services are community-based. So they're are providers that'll go out into the home and provide that intensive work in the home. We also work really closely with Riverside crisis teams. So if we're connected with a family who calls us and says, you know, my child is in crisis, this is what's happening, we can help guide the family to call Riverside Crisis, or we can even call Riverside Crisis for them, and they'll provide crisis management within the home to evaluate that child, to find out if do they need a higher level of care, meaning do they need a partial program, like a day program or an inpatient psych program or something like that, to really help support them through whatever crisis they're in.
Someone may call us with an issue that we're not able to help them with for whatever reason, but that doesn't mean we hang up the phone. It means we'll talk with them a little more, find out what they're looking for, and then make sure that they're getting connected to whatever that resource is that will help them. And that's the beauty of working as a team and forming this collaboration, is that we've all really learned a lot about, you know, what each partner does and what they bring to the table, what they can offer, so we can be sure when we're giving out that resource that we know that there's a voice at the other end of the line that's going to help that person.
Another essential component of the CCIT model is training. The Needham Police Department joined the One Mind Pledge initiated by the International Association of Chiefs of Police. The pledge requires participating law enforcement organizations to train all their officers in mental health first aid and at least 20% of the officers in crisis response training. Starting 2016, Needham has been continuously sending officers to the state-funded crisis intervention training, a 5-day, 40-hour program designed to give police officers better recognition, communication, and de-escalation techniques when dealing with people with mental health illness and other vulnerable populations.
That's a significant benefit of what Needham Police have committed to, is to train their officers specifically on crisis response and understanding particular mental health conditions and how those look. You know, we look a lot about veterans and PTSD, and it might look like someone is argumentative or defensive, but when you understand, perhaps someone's startled and runs, you know, you understand that there are certain things that can be underneath and inform people's behavior. It gives our police a broader sense on how to respond. The same goes with a young person or an adult who has autism diagnosis, who might be sensitive to sound or can't speak, and they aren't being argumentative or acrimonious. It's the police appreciate understanding the broad spectrum of diagnosis and mental health conditions or behavioral health conditions that people navigate and live with, so they can respond on their own in a more effective way.
A lot of it is de-escalation. A lot of it is learning or trying to develop an empathy for what it would be like to be dealing with a mental health issue. People, you know, try and put yourself in the shoes of people that are suffering from mental illness.
We watch videos, we go through some exercises, we do some role playing, and we actually at one point we'll walk around Brookline with tapes going through of people that are just kind of like it's simulating people hearing voices. So we're supposed to be hearing these voices as we walk around and then kind of interact with people, store owners and stuff like that, to get the realization of what some people go through, and how difficult it may be for them to reside in a community and be productive with them hearing voices, or stuff like that. So it was a very enlightening, and gives you a definite perspective on how some people really are going through life.
Learning about protective orders and what the process is when someone's brought in on a protective order, what evaluations are done or not done, when they can be held for how long. It gives you more of a perspective than prior to training. I thought, well, I just bring them to the hospital and they fix the person. That's not always the case. They need a lot of support and services in place usually to begin that process of not going into crisis. So I think that provided a much greater perspective on what you're doing, and understanding when it's okay to do an in-house evaluation versus when the person needs to be taken on a protective order to the hospital.
David Forte is the Community Outreach Officer for the Needham Police Department, a position created in early 2020 to better respond to residents suffering mental health and substance abuse. Forte is able to spend a great deal of time providing follow-up services and directing individuals and families to appropriate resources.
The old school of policing was get in, take care of what you need to take care of, and get out. We're a lot more time-oriented in the offices when they do respond, but again, they can't be there for hours, in one call. So again, my role is, again, to come kind of be in there and give them the time that they need.
Officer Forte has made himself available to certain individuals that just really need to be able to call him when they feel like they need to call him. He's developed an unbelievable rapport. We feel like we can reduce the workload of patrol by providing services and getting services for these people when they're not in crisis.
The department allows us to do this, which is great. I mean, when I tell you we spend sometimes hours and hours and hours with one particular person or a family or something like that, and they allow us to do that, which is fantastic. It's a time-consuming, but it's also gratifying, because most of the time, not always, but most of the time, it works out well. I don't have all the answers, and I don't even sometimes know where to go get the answers, but I can reach out to enough people and put where I do find the answers. And I do a lot of self-research myself. It's not wasted time that I'm wasting, because the knowledge that I gather there is definitely kind of will go on to the next time that comes up.
According to Deputy Chief Baker, about 50% of Needham police officers have acquired their crisis intervention training.
Whenever they offer the class, they offer us 2 seats and we send 2 people. So so we haven't ever said no. So we've kind of they give us 2 seats because space is limited. A lot of police departments in the area find great value in the training. So we're kind of slowly but steady training our staff.
It works even better because the officers on the street have the training. If it was just me and a handful, it wouldn't work. I think it's really important that the officers that are the frontline guys and girls that are going to these calls have the training, because it's the initial interaction that they're going to have with somebody that's really going to set the model, really. Because if somebody has a bad experience with an officer, they're going to be really reluctant to kind of reach out to me, or for me to even call them, and say, hey.
We feel it's important enough that our policy says that a crisis intervention officer should be sent on every mental health call if they're available. So we feel like the training is that solid.
This year, a part-time clinician from Riverside Community Care, Kim Killers-Montoya, joined the department to respond along with police officers and provide clinical support. Riverside Community Care is the state-designated regional emergency services provider that covers Needham.
She is a social worker like our social workers, but because she works in the emergency services state program, she can have access to things that are a lot deeper and broader than we have real time. Like if one of our residents is in the emergency room at BID Needham, that social worker in the Needham Police Department can have access in a confidential way to the discharge date, where they could offer them the next level of care, because she has the real-time information on beds, and then be able to communicate just the current health status and safety status to the police and to the public health nurse. So that is why we decided to go with that model, because they are statewide, connected to the electronic treatment bed, respite care, and electronic medical records.
She has an office in our department. She has access to our records. She she calls our police dispatch and she puts herself as available, so everyone on the shift knows that our clinician is available if we have a situation where she can respond. It's safe for her to respond. The sergeants make those determinations.
She also co-responds with police and attends our CCIT meetings.
We've had situations where we've had an active crisis, but it wasn't to the point of people's safety being in danger, and she's actually gone out in a co-response situation and provided an in-house evaluation instead of an evaluation at the hospital.
An officer would respond to a home for whatever the call of service would be. They would recognize that, okay, there's more to this than just whatever the call may have been, and that this needs to be a further follow-up or some sort of further assistance to these residents. And they would forward the report to myself and Kim. Me and Kim would take the report. We would talk about it. We work very well together. She brings a lot of her knowledge to it, and I have, my knowledge, and we work off each other. We'd talk about it, we'd decide what approach we're going to take, maybe what services that these people may need, and then we would do a follow-up call, or, since COVID, it was more or less all phone calls, but we'd do either a call on the phone or would follow up to the residents, try to sit down with the residents, introduce ourselves, tell them what, what we can provide for them. And it's all up to them. It's one of those things that not all of them, but some people just say, well, we're all set, we're good with it. And we don't let it go there. We follow for a long time with whatever residents may be. And again, it's a rapport building, kind of a trust building kind of thing for us. And we get close to these people where they're comfortable as talking to both of us or one of us. She has people that she'll talk to because for whatever reasons there's a better fit, and I have the same. We go over very low keyed. I'm normally dressed like this, sometimes even more casual. We go over in an unmarked car. There's not a police car in front of the home, so people are comfortable.
Reactive is unpredictable. We're going into situations where people have reached the point where they're in crisis. In my experience, people are unpredictable in crisis. Decisions have to be made in seconds, and I think there's a higher potential for risk to officers on scene, as well as the person in crisis or any bystanders or family members. It's much better to provide. I like to think of it as sometimes we try out of the box thinking, okay, well, we tried this and it didn't work. What else can we do? Officer Forte and our social worker from Riverside have obtained employment for somebody that they thought could really benefit from employment and being out in the real world and making a living for themselves. I consider that pretty out of the box.
Although it is still too early to review the outcome statistically, the CCIT members see a positive trend starting.
I can tell you, particular, there's been a couple of that stick in my mind of success where the residents were addicted to alcohol for years. I mean, 10, 20, 30 years. And pretty much we had a lot of calls of service to their home, well-being checks, out of control, whatever it may be. And again, back to the olden days, the old policing would be, okay, we'll just every time something happens, we'll respond there and we'll deal with it and we'll be done. Again, the officers recognizing, there's issues. This is not a one-time thing. We follow up, and again, I'm thinking in particular too that were very, they were complicated. They were time-consuming. But I can tell you that both of them been sober, going one on 2 years, one going on 3 years, which is fantastic. There were some setbacks, and we followed through, and we were in total communication with them during the setbacks. And I find myself sometimes, on the phone at night, sometimes coaching these people. And on the other side of it, I recall there was a case that basically was about almost 2 years that I dealt with this person. And it turned into a criminal case. And the short of it was, and when I tell you this particular person dealt with her multiple times a week, multiple times a day sometimes, talking on the phone, and sometimes for hours, emails and phone calls. And this is one of those cases where it wasn't really a criminal response that needed to be done, but there were criminal complaints taken out for a number of reasons. And the outcome basically, only because we were able to get her to a doctor, was basically the whole cause of this was a medical. So it was a medical issue they had. Once the medical issue was resolved, she was good.
There are repeat people that call or have incidences, and we know who those are that struggle. But when the social workers and the public health nurses and police work together between the emergency calls to visit with people, to make a connection, the emergency calls go down, because it didn't get to the point where people feel alone and in crisis.
We're, again, alleviating those calls or minimizing those calls of service by our following through on them. So the numbers, I can tell you, have definitely dropped. But there may be somebody new that may come into the realm of it. And so there's a continuous kind of fold of people coming in that we have to kind of deal with, and we bring those numbers down. It doesn't always work. I can tell you that sometimes it just doesn't always work. For the addiction part of it, I can tell you that we work with a handful of people constantly. Unfortunately, sometimes it doesn't always turn out well. We do our best, and we take those very serious. And we work, again, closely even with the social workers that are in Needham. They're great resources for us, and we work hand in hand with them, and we're in communication constantly with them on all aspects of the addiction issues or the mental health issues, some of the homeless issues that come up. We work closely with them. So I think with the team effort of everybody, we've diminished a lot of our continuous calls of service from particular people.
During the interviews, many members stressed to me CCIT's response is not punitive. They do not force assistance on people and are willing to go with individuals' own pace. They encourage at-risk residents and their family members to pick up the phone and give any of the CCIT partners a call if they fear an unpredictable crisis.
I think the model of the CCIT is really to help keep people out in the community. So whatever that means, out of jails, out of hospitals, finding the least restrictive setting that can help support them as best possible. So setting up outpatient services fairly quickly, getting people with substance use issues into treatment quickly before it escalates to the point where they need kind of a detox program or an inpatient program, keeping people out of jail, and helping kind of them get treatment so that there aren't crimes committed. When there are substance use issues, sometimes people will go that route to be able to support their substance use. So we're really just trying to keep people in the community, provide community-based services and support to keep them in their homes in a way that's safe and effective for everyone around.
There are various entry points for help in Needham. Our director, Tim McDonald, has emphasized that people are welcome to call the Public Health Division to speak to the nurses, to speak to myself, to call the social workers at Youth and Family and the Council on Aging, to call the police. And so what we want people to know is that you are not alone in Needham, and there aren't going to be negative consequences, and your information will be respected. What our goal is to, between us all, to be able to sit with you and provide information, resources, help, referral to treatment. And then, in social work, they call it wraparound services, whether you need a referral for food support or financial advice or job training. There are so many resources that we know of that we can connect people to. And it's vital to let people hear that mental health and addiction, these are physiological conditions which can be treated successfully. People need to understand that there's help, and you don't have to suffer by yourself or your family members suffer, because we are committed to making those connections.
That's all for our special program on the Needham Community Crisis Intervention Team. I hope it gives you a better understanding of how Needham responds to at-risk residents and where you can seek support if you and your families are in crisis. I'm Yu Xiaoyuan. Thank you for watching.